Welcome back to Spotlight. I'd like to welcome my next guest, Ms. Ivy George. She is the national point person on non-communicable diseases. Thank you for coming. Good to have you.
Thank you, Mr. Smith. It's good to be here.
Yes, there's a lot going on in the ministry. Since you did the study a few years ago, you collected some data that showed that 47% of the people of the Virgin Islands are suffering from one chronic disease or the other.
Yes.
That sent out a general alarm that something must be done.
Yes.
To stem the rise of non-communicable diseases. Tell us what some of those non-communicable diseases are, so that people get a sense. Because we use that broad term, and I don't know how many people really understand what that means.
Well, we are talking about here is some cancers, diabetes, and heart disease, and to a lesser extent, some respiratory problems. And I think the one that we would have the most difficulties with would be asthma. Mm. So it's those three and the complications and the risk factors that leads to these complications that we are mainly concerned about.
And what are some of those risk factors?
The risk factors are in physical activity, a lack of physical activity, unhealthy eating, especially as it relates to vegetables and fruits, and some fats, and the other one has to do with the misuse and abuse of tobacco and alcohol.
And when you say lack of physical activity, you're talking specifically about exercise and just movement generally?
Yes, movement in general.
So I know that you have a broad strategy for the prevention of chronic non-communicable diseases.
Yes.
And you just got a framework for
the social
marketing aspect of that, to implement that
component,
that policy, that strategy.
Yes.
And now you're doing a pilot program. That pilot program, how does that mesh into that national strategy?
Okay. The implementation structure is one that has three components. The one component deals with involving the private sector and the businesses, but that would be mainly the businesses, and we also have on that committee some people from like the Rotary and the Lions and the Chambers of Commerce. Then at the government level, you have an interdepartmental committee, and on that committee, which is chaired by the Honorable Christian, you have people like education, the Ministry of Communication and Work, Agriculture, Education, the Social Security Board, the college, the Department of Sports. So these are some of the other agencies that we are working with, because some of the things that we are dealing with, the social determinants of health, are not really in the Ministry of Health. So we have this interdepartmental committee that will be looking at policies, other kinds of strategies that we need to put in place, and regulation. And this committee then, this technical working group then have some subcommittees, which we have one for schools, we have one for tobacco and alcohol, one for physical activity, and for healthy spaces and places. So that is more at the national level. And the third arm of this implementation was for the community. And so to get the community involved, what we are doing is we are partnering with the community, and we are piloting this project in 5 communities. We are doing it in Easton and Long Look, Hope Hill, Bellevue and Long Trench, Virgin Gorda, Seacoast Bay and surrounding community, and King Garden Bay and surrounding community.
So how is this pilot project going to work?
The concept is that we are trying to set up a community health and wellness committee, And on this committee will be government agencies working at the local level, some of the and non-profit organization, which would be like the churches, you might have youth organization, etc. Some of those will be there, the businesses, and then there room for people who have an interest, about 5 to 7 community people. That's your kind of your steering committee, and again you will also have interest group that people will be able to be a part of.
And what are those groups and that committee is going to do?
Okay. We are talking about building healthy community from the ground up, one community at a time. So this community is sort of like a coordinating and a planning body that will come together and will look at what are some of the needs in the community. And we have a model, and in the model we have the community committee, and then you have 3 priority project will come out of the community. The other part of the model call for some cornerstone program. There are 4 of them, which will be conceptualized at the national level, but will operate at the community level. And then the input from the ministry will be sort of technical support, capacity building, and financing. And notice I say financing as opposed to funding, because financing, it means that we will be working with the community and finding wherever we can find money from, not necessarily that it will only come from government.
Okay. Now, I'm trying to get down to the nitty-gritty
Yes.
of this program. So how we are going to get us to begin to engage in a healthy lifestyle, to get us to change our lifestyle? What is going to be the point of attack?
Okay, for example, like I said, there's we'll be attacking it from different ways. One way, for example, we through the physical activity committee and the BVI Olympic committee, we are rolling out like a national, we are hoping to fund and roll out a national walk-in program. And walk-run program, we know that this is a cost-effective way of helping people to move at least 30 minutes. We are saying at least 5 days a week. So this will be something that will be, you will have the education and so being promoted from the national level. You'll have people on the ground, and we'll have trying to encourage to people at the community level. They are already walking, but we're hoping to get it more structured and to get more people involved.
So we're going to have organized walking clubs, for example?
Yes, organized walking groups. We're going to try those. There are people who are not going to walk in groups. We're also going to do 10,000 steps a day. So with that would be by pean monitors. Then there will be people who would be if you want to, like, for example, there's already a Saturday morning walking group that is walking all over. So if you want to get more exposure, we will be encouraging you to get involved in something like that. Then either monthly, it depends on what the community decide, or quarterly, we want to promote some community walks, where you try to bring as many people together.
What about getting people in the community involved in sporting events? For example, I would prefer to play basketball and tennis and do karate than to walk.
Yes, I'm saying those would be things that we would be encouraging people that you can do these other kinds of activities, but I'm saying the walking one is a cost-effective best practice, and the fact that it don't take as much to roll that out, whereas some of the others will call for
facilities,
a facility, and also for a trained person to lead it. The walking wouldn't take that much. So we know that this is something that is best practice and it's cost effective.
And how are you going to motivate us to do this?
Well, as I mentioned, we will have on the ground, and also it's part of the rollout for the national social marketing campaign.
So then you will be you'll have information on television
And
information on radio,
Joe,
in the
and
newspapers,
yes,
public,
and social media and stuff like that.
encouraging people to walk and go and
Yeah.
get involved in a group and
Yes.
exercise and so on.
So we'll be putting in education and also saying how you can do it, making provision
So there's
to
the
help you
education
to do it.
component as well to tell you how to do it properly,
Yes.
how to do it in a healthy way,
And then
and how to not injure yourself, proper clothes and shoes and so on to wear
Yes.
and that sort of thing.
and that you can do it. There are people out there doing it. You can join a group or you can do whatever.
Now we have some facilities. Well, first we have some challenges walking because we
Yes.
don't have many sidewalks,
Yes.
and we have to walk mostly either early morning or late at night or late in the evenings because the sun is hot and we don't have any tree-lined blocks and tree-lined sidewalks. So that, I guess that would be part of the facilities approach that we would take perhaps at a later stage in the program.
Yes, and there's also, as I said, there's a committee that is called looking at the built environment, healthy spaces and places, and dovetailing into that part of the walking program involve assessing your community and determine its walkability, and then out of that will be information now for advocacy.
Now we have a big facility. We have two big expensive facilities in Roetown, for example. We have the A.O. Shirley track,
Yes.
right? Spend millions of dollars for that. Are we going to have that open up so that we can go there and walk or jog or play as on demand as we wish?
I am sure that is something that there is there is a physical activity committee, and information like that will come under that particular
So we're
committee.
paying thousands of dollars a month to keep the floor in the multipurpose sports complex air conditioned, keep that floor cool, and well, it's being used more and more. But are we going to have those facilities open? The facilities that already exist, it seems to me that we could make better use of those facilities, considering the fact that we are paying a lot of money to maintain them.
Yes, and as I said, the people involved in that sport and complex is also one of the person that is on the national physical activity subcommittee, and I'm saying at that level is where decisions like that will need to be, recommendation will need to come forward that will then go to the relevant bodies to make those kind of decisions. But what is good is that we are now having most of the players at the table. That is something that we didn't have before. Mm-hmm. So when people come to the table, we have a discussion, then you come back to this monthly meeting that is chaired by Honorable Christian, and most of the whole idea is that coming out of these committee meetings, people will come with recommendation papers and so things to go forward to the right agency. Where we now have a forum for discussing a lot of these things, whereas before we didn't have that.
Okay, but we want to see some action. We've been talking about this for a long time. We got to take a break for word from our sponsors, and when we come back, I want to talk some about the eating part, the nutrition and the diet, which of course is perhaps either next to exercise or just above exercise in the scheme of maintaining wellness. Keep it locked right here to Spotlight. We'll be right back after these words from our sponsors with more of this new initiative coming into our community for prevention of non-communicable diseases. We'll be right back.
Spotlight is brought to you by Virgin Island Motors, Tortola Concrete Limited, Bolo's High Tech Printery, and H. Lavity Stout Community College.
Welcome back to Spotlight. If you just tuned in, I'm here with Ms. Ivy George. She's a national point person for the implementation of a strategy to reduce and prevent non-communicable diseases here in the territory. And we were talking about exercise program and facilities that will be coming on stream to allow us to be more active. Activity is part of the strategy to reduce and prevent and reduce the rate of non-communicable chronic diseases such as heart disease, cancers, high blood pressure, diabetes, and so on, which are lifestyle diseases. Healthy cooking. Now this to me is going to be your challenge. Healthy eating and healthy cooking is going to be a challenge because you have to go deep into the culture to get that change.
Well, okay, well, tell me why you said that.
Well, we've been accustomed to eating fried chicken and barbecue chicken and stewed chicken and fried fish and Johnny cake and rice and macaroni pie and potato salad and you don't hear any and the vegetables we constantly eating dead vegetables. I mean we overcook the food. We cook the vegetables till they have no life, no nutritional value. A lot of times we don't eat vegetables, and the salad is just a garnish. And most times we don't eat salads, and lettuce and tomato is usually, if you go to sit down in a restaurant, and you would notice that the lettuce and tomato, and they only bring lettuce and tomato. You don't get lettuce, tomato, cucumber, red onions, black olives. You don't get that. The lettuce, you get a little piece of iceberg lettuce that got no nutritional value with some tomato on top of that. It sits on the side of the plate, and it goes back with what's left of the fried chicken, the bones, and the macaroni pie.
Well,
how you gonna get that change into farm vegetables, no macaroni pie?
Well, as I said,
salads.
Mr. Smith, Edgewinker, is that we have to start somewhere. And there are some people who are already doing some of these things. And again, like I'm saying, in the past, what we did, we get on the radio or we put out pamphlet and say, eat healthy, do so and so. But what is this? So by having the actual classes and so, we are hoping that we'll be able to show how some of these things can be done.
I was hoping to have a television program, not me personally, but to have a television program. Like how you see cooking chef programs on TV. Well, have a chef program and showing people how to prepare the kinds of foods that they need to prepare, and have an explanation of the kind of food, the nutritional value, the health benefits, and the way to prepare it so that you get the nutritional value.
Well, I wouldn't say that is something that has been ruled out. We have discussed that in the past before, and I don't want to elaborate because I have not had a chance yet to discuss with the agency that we are looking to or hoping would be able to give guidance in this particular area. I'm hoping that I'll be able to meet with that person soon, and that they will be able to then decide, apart from at the community level, because we do want to have that, what else can be done, and then finding the right sponsors, etc., to do such a program. So we are not ruling that out, but we do know that we need to show people, because sometimes I think if you can just show people that it might not be that difficult to make a shift in some of what we are asking them to do.
Well, you're certainly education is going to be is one of your components as well.
Yes, I'm saying, so what we are doing now, instead of just giving education alone, we are actually want to put in place practical things, hands-on things, so that you could actually say, look, okay, this is how you go about doing this.
One of the challenges everybody talks about, particularly with food, is how you're going to get the supermarkets to reduce the cost of healthy foods and instead of having a low cost on the junk foods.
Now, this is something that a number of other countries or other places have been able to do. It's going to have to be something, not only demand is also something that is very important. So once people start to demand a certain thing, after a while, I'm sure then any wise person in that kind of business would begin to think on meeting the needs of the consumer. So I am hoping that that is why I'm saying by actually having people experience and go through this particular process, then that they will be able to say, okay, this versus this, what is the benefit and what do you want?
So it's education, the practical experience, the behavior change, the demand, and then the supply will change as well.
We're hoping.
Yeah. When are you going to roll this program out?
Well, I'm saying we are already now starting with, for example, we know that the Eastern Longlook and King Gadenby community, they are the ones who are just about ready, have most of their component in place. So we are hoping to get this rollout for sure by the Caribbean Wellness Day to start having some of these activities.
And what day is that?
It's the second Saturday in September.
Okay. And can people contact you who want to participate and join a walking group and help to start the ball rolling?
Yes, and also we will be hoping to also have ways how you can contact. We'll announce who the people in the community are and who are the coordinators in a subsequent news release. And in terms of the gardening too, because as you said, as we mentioned earlier, fruits and vegetables is one of the areas that we know that fruits and vegetables are a protective factor, and we are not eating as much of those as we can. And one of the things that people often say is that it's very expensive, but we have been looking at a number of other places, what some people are doing, and how we can help people to say, okay, you can grow certain things. We are looking at container gardening, we are looking at rooftop gardening, we are looking at community gardening and backyard gardening. And some people can participate in some way, in some sort of it. And we are saying you can grow some things to eat, and then you supplement these with things from the store.
So you're hoping that we will start planting our food?
We will want to encourage more of that.
Okay. We fall under the tyranny of the clock.
That's right?
We have fallen under the tyranny of the clock.
Oh.
Time up.
Yes, okay.
So anything that I forgot to ask you that you want to mention that we didn't get out?
Well, the most important thing is that we are saying it's a government-community partnership. And this is very important because over the years, working in the community, it has always been one-sided. The government saying this is what you need, and we don't have buy-in. And in order to have long-term ownership and sustainability, you're going to have community buy-in. The community must have an interest, must be given a voice, and must lead. So this is what we are hoping to do with this particular type of program.
Ms. Ivy Judge, thank you very much.
Well, thank you so much for having me.
For coming, and it's interesting. I'm excited about it, and it's something I've been looking forward to for a long time. And certainly, you have my support, and anything I could do to help, feel free to call on me.
Well, thank you so much, and we will.
Great. We're going to take a break for word from our sponsors. We're going to come back with members of the Tourist Board. We're going to talk about the We Are One BVI service training, the communication specialist talking about the way to communicate in a crisis, and as well as what we are doing to help our small properties develop. Small properties are usually our locally owned properties, and we need to foster their growth and development. Keep it locked right here to Spotlight. We'll be right back after these words from our sponsors.
Spotlight is brought to you by the National Bank of the Virgin Islands, Clarence Thomas Limited, the BVI Tourist Board, and CCT Global Communications.